Carle combines clinical care, health insurance, and research in a way that solves problems today with an eye toward the future. Supported by a deep philanthropic spirit and dedicated to making life better for as many as possible.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HSHS St. Anthony's Memorial Hospital.
Sara Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sara Bush Lincoln Health System.
Hi, and welcome to this episode of Being Well. I'm your host, Keanne Armstrong, and today we're going to be talking about a number of different things that have to do with our muscles and our bones and what a critical role they play in our health and our ability to do what we want to do and what we need to do. And so joining me today is Sara Masse, and she is the lead clinician for Carle Therapy Services in Mattoon and Charleston. So welcome. Thank you for joining us.
Thanks for having me.
Yeah, so this is something that I think that we all need some information on at any age, no matter whether you're young or old, because you treat people at all different ages, correct?
Absolutely. Yeah, we see everybody kind of through the lifespan. We start pediatrics as early as 2 or 3 months old and work through the geriatric population in the upper 90s.
Yeah. So our muscles and bones, they play a critical role in our health and what we want to do and what we can do, but they also present challenges along the way, like from overuse, underuse, and just an array of other causes. So let's start out by talking about what kind of healthcare services does your team provide at Carle Therapy Services?
At our facility here in the Mattoon-Charleston area, we have physical therapy services that kind of covers a wide array of musculoskeletal conditions, neck pain, back pain, post-operative procedures, if you've had a knee replacement or shoulder surgery. We see children with developmental difficulties, and we see work conditioning patients or work injuries and those kinds of things, and kind of anything through the gamut of being able to walk, move, and do your daily tasks throughout the day. We also have an occupational therapist on staff, and they work more specifically with the hands and upper extremities, help with fine motor skills, maybe after someone's had a stroke and they can't write or sign their name anymore, or daily activities like being able to hold a spoon or fork and take care of themselves.
Okay. So there's a difference between physical therapy and occupational therapy.
Yeah, there's a little bit of overlap, but there's definitely a clear-cut difference in working on different aspects of daily function. And we both kind of have our specialties with where we overlap, but where we kind of draw a line and divide what specific services we can help people with.
Okay, how many people are on your team out there?
We have 3 physical therapists, a physical therapy assistant, an occupational therapist, and we also have an athletic trainer in our office.
Oh, okay. So talk to me about the athletic training a little bit.
So athletic training services is a little bit separate from therapy. It's through the sports medicine department, but they offer a free clinic for injuries with athletes that they can come in and kind of be screened and determine if they need to see a physician or what kind of follow-up they need to do, be given some ideas of exercises that may help them. And they also offer a sports enhancement program where you can come in for a 6-week stint and work on improving your skills in athletics, so running faster, jumping higher, and just getting a little bit more of an edge on your sport.
So as we're sitting here, we're sitting nice and straight, we're not slumped over. Our posture plays a big deal with our muscles and our bones and our bodies. So how does posture impact what we do and how we feel?
Posture plays a big role in being able to maintain a good position of your spine. Your body is designed to maintain a proper posture, and your muscles and bones are designed to work best in that proper posture. When we slouch, when we kind of forget about good posture and kind of start to fall forward. It can change how the muscles and things work in the body and can cause pain or can cause some different problems to develop.
So if somebody does have sort of like that hunch, what kinds of problems do they suffer from? Is it pain? Is it mobility? Both?
It's absolutely a combination of both, yeah. A lot of people, especially with like desk jobs, or if they're sitting in a chair a lot and they're not paying attention to their posture, or their hands are forward on a keyboard or reaching for a mouse, our shoulders round forward, our heads come forward as we're looking for a screen or something in front of us. And the muscles on the front of the chest get tight, the muscles on the back get stretched and weak, and then we have trouble coming up into this tall posture because we're just forward. So you get a muscle imbalance, you get some weaknesses. That's going to increase your injury risk because things aren't working properly. And also a lot of people get a lot of pain. A weak muscle tends to be more painful. And you can get like trigger points in the upper traps and things that a lot of people will get headaches and that kind of thing as well.
Okay. So when you think about the posture, I guess I think mostly about the back side, so it does affect the front side as well.
Absolutely. Yeah, you get some tightness through the chest and through those front muscles, and it can change kind of how your shoulders work when you're reaching overhead and doing different tasks like that. And also, like I said, it makes it harder then for those back muscles to work because the front is too tight. We do a lot of stretches, standing in a doorway, putting arms on both sides and stretching back is a great stretch to kind of open up the chest. Also work on a lot of postural exercises, working on those mid-back muscles, the posterior shoulder muscles, and those kinds of things to help people be able to pull those shoulders back and stand up tall.
Thinking about people who maybe sit in an office setting a lot and they're sitting stationary, I mean, it's good to get up and move. And you see a lot of people transitioning these days to like the stand-up desks, right? So talk to me a little bit about what you suggest for folks who are in an office position.
Changing positions is great. Staying in one position, be it sitting or standing for too long, isn't great on your body anyway. So the standing desks, if they can be adjustable height where you can use them in sitting and then use them in standing, are great. Your computer setup, obviously you don't want your monitor where you're having to turn your head. You kind of want it in front of you so that you can look straight. If your keyboard or mouse is somewhere where you're reaching and your arms constantly out in that stretched position, you're going to become a little more forward and you're going to work those shoulder muscles a little more than they need to be. So kind of keeping things close to you. Some people like to sit on the Swiss balls, which helps engage your core muscles and helps kind of remind you to keep a tall posture, because if you slouch on those, you might roll off. So doing different things to kind of change your position, be aware of how you're sitting. Maybe sit towards the front of your seat instead of just reclining into and resting against the back of it, can help you engage your muscles and work on your posture as well.
I noticed in my chair, if I have a little lumbar pad back behind, it helps me sit up better, so I'm not either slouching or I'm not sitting up too far, because it pulls on your arm, with your hand on the mouse a lot. And then trying to find the correct position at your desk as well. Should I sit in the corner? Should my chair and my desk, aren't sitting quite right. So does that affect maybe your lower back and your hip area, your legs?
Absolutely. The ideal posture or sitting position is where your knees are equal or a little bit higher than your hips. So if your chair is too tall and your legs are down, it can pull on your pelvis and cause some low back pain. You can also, like you said, use a lumbar roll, put some kind of support in your chair to kind of give you a cue to remember to keep your pelvis tilted forward instead of allowing that to fall backwards. And again, it does help you as well stay closer to your workspace and the things that you need at your desk.
Okay, let's talk about a little bit of technology, smartphones, different iPads, different things, that are technology that maybe people are either like constantly, they have their neck, and I notice it with myself, I'm like, oh gosh, I gotta stretch, I gotta move my neck. Talk to me about some different things that maybe you've seen in the more recent years versus when we didn't have phones like that.
Right. Well, it started with computers, really, and desks went to kind of a clean surface, and they put monitors in the desk, and so you would look down and look at your monitor all day. Well, now we've got that in the palm of our hand, so we sit with our phone and scroll through and do whatever. We're sending emails all day on our phone or using a tablet, and we are looking down. The human head weighs 8 to 12 pounds. When it's in its natural posture, that's the weight that the spine feels through the body. with every degree forward your head goes, and when you're down in about this position, the perceived weight of the head through the spine is about 70 pounds. That's a lot of force that goes through the tissue of the neck and the pressure on the discs. So it's really better if we can look up, bring your reading material up to eye level instead of looking down all the time, even with reading the newspaper in the day. Some people still sit and read newspapers in the morning.
Yes, they do.
Instead of looking down, think about bringing that reading material up so you're not looking down. Or if you read a book on a tablet, the position that you lay in bed even can be affected. So try to remember to sit up and bring that material to eye level instead of looking down.
Right, and stop putting so much stress, constant stress, I guess. Okay, so I suspect I know the answer to this, but a lot of people, they want immediate gratification on things. So when they go into physical therapy, can they expect any kind of quick fixes?
It's typically not a lot of quick fix. It takes a little bit of effort. Our job is to help people learn how to help themselves. So one of our primary goals with all of our patients is that they are independent with the home program to manage their symptoms on their own. A lot of times we like them to be able to continue a little bit of a stretching program or a strengthening program kind of throughout. We get them in a habit of, you've done these on a daily basis. Now, if you can maintain that on a 3 to 4 times a week basis, you shouldn't see an issue with a problem recurring. And it typically takes about 4 to 8 weeks, depending on the problem. If it's just like a chronic neck pain or a back pain, learning those postures, changing habits. You didn't become forward overnight. If that's your problem, it's not going to change overnight. You've got to stretch out muscles, strengthen other ones, and then learn and retrain your body how to properly move.
Kind of like weight loss, weight gain. It didn't happen overnight. It's not going to happen. All right. So is there a difference between the timeline of healing or feeling better, I guess, with like a joint replacement versus an injury or a surgery? Can you kind of talk about
all of those are going to change. They depend on the procedure you had, absolutely, and they also depend on the person. So you look at, and like you brought up joint replacements, a lot of people that have a joint replacement will compare themselves to a friend who also had a joint replacement. So a lot of people know someone going through that, and they'll say, well, my friend was doing this at 3 months. Well, then you have to look at what were you functionally doing prior to. Some people come in and they haven't been able to straighten their knee for 2 years, and they have a joint replacement and they think it's going to go straight right away. Well, your muscles are still there. They didn't replace those. So those have to be stretched out and kind of relearn how to move again. So there's a lot of work to do to get through that. Some people gain that motion back really fast and other people take a little bit longer. A lot of surgeries have protocols that we follow. So there's a natural healing process of the tissue in the body. And so they have done lots of research. The physicians as well as therapists work together and develop protocols kind of for best healing process as well as best recovery. So we can kind of guide you through a program to return your motion and then return your strength and function. So some of those we can give a handout to patients and say, this is what this is going to look like. At 6 weeks, you should do this. At 12 weeks, you should do this. And at 4 months, we should be back to doing what you want to be doing. For a joint replacement, typically the biggest gains are seen in the first 3 months. You'll continue to see some notable changes for another 3 months, and then through a full year, there will be some things at that 6-month point that you'll be like, man, I still can't do this. And by the time a year comes around, you're able to do it again. So it is a test in patience, absolutely, but typically well worth it.
I'm sure you see this on a daily basis. Like, I'm really frustrated. This hurts. I don't want to do this. And you have to keep prompting people, like you'll get past the pain, or, I mean, what do you tell people in those situations?
Well, there's a little bit of a guideline there. Some people say PT stands for pain and torture, and really that's not true.
That's not true.
But some people feel there's a lot of truth to that. But we do encourage our patients, we make sure that they do talk to us, because some amount of pain or discomfort is kind of to be expected, but there's a threshold, there's a level that, we're not pushing people past this excruciating pain to try to get them, because there shouldn't be pain that's that severe. But definitely, sometimes, especially after a surgery, your recovery isn't exactly butterflies and rainbows all day.
Rainbows and roses, yeah. Well, it's just like anything, you're working towards a goal. You have to have a little bit of pain to get to where you're going, and so once you get past maybe that pain threshold, you got to keep pushing and get your mobility back.
Absolutely, yeah.
So, All right, well, let's talk about what does your team provide for people injured at work, and how do you help in those cases?
We see work injuries frequently, and they can vary anywhere from people that have desk jobs to people that are working in factories, and these different kinds of things. Work injuries come in various ways. We try, of course, the goal is to get you back to your job. What were you doing before? And how quickly can we get you back to that, but also safely. We don't want to take a work injury and rush them through the rehab process and throw them back into work,
right,
only to have them get re-injured again. One of the ways we kind of help limit that re-injury is to do work conditioning, where people come in and spend 2 to 4 hours a day kind of going through a program in our facility where they build their endurance and strength back up, especially after a major injury, to be able to get back to work safely.
Okay. Well, let's change the topic a little bit here, and let's talk about something that maybe isn't so easy to talk about, is pelvic health and urinary incontinence. A lot of people don't want to talk about it, they're embarrassed by it. So when they come to see you or one of your team, how do you help work through those issues?
That's kind of a taboo topic, unfortunately, still. And a lot of people don't know that therapy is an option to work with pelvic health problems. So you've got the urinary incontinence, like you mentioned, pelvic pain, during pregnancy, postpartum things. There's a wide array of issues in that pelvic health realm, as well as after prostate surgery. Even men have some issues sometimes. And a lot of people think still, you see the ads on TV for different products and things well, it's kind of part of life, use this and deal with it. And actually it's not. Though it seems like it's a normal part of aging, it's not something that you have to live with. So there are exercises that you can do to help strengthen the pelvic floor. Sometimes the problem is your pelvic floor is overactive and we have to downtrain those muscles. There's also a big overlap in diet, what you eat and drink, your activity level, and habits you've developed. Sometimes we've grown up with your parents saying, be sure you go to the bathroom before you leave the house, and you get in the habit of emptying your bladder before it needs to be emptied. And that can cause some problems down the road as well. So we work with people really kind of educating them about what is good bladder health, pelvic health, and try to help them kind of improve what they've done naturally throughout the years. Magically when we're 2 or 3, we learn how to use our pelvic floor and become potty trained, and we don't think about it again until an issue arises.
Right.
So it's really something that just takes a little bit more education, and helping people understand that part of the body that sometimes, unfortunately, they've been shamed about. That we really help them understand this is normal. This is just another muscle in your body that needs to be worked with, and you can't ignore it.
Right.
And if you do pay attention, people usually make great gains with therapy. So it's been a good addition into the clinic.
Yeah, something new and different. You don't have to live with that. Seek out therapy for that problem.
Yeah.
So let's talk about some services that patients can expect for maybe cancer-related topics.
Absolutely. So cancer is unfortunately way too prevalent anymore. And there are a lot of side effects that can happen, be it from the surgery, from the medications to treat it. A lot of people have issues with just general deconditioning. So they are fatigued, their muscles weak, they may spend a lot of time on bed rest or in the hospital, and really need a little more just kind of general strengthening, mobility training. Sometimes they may have difficulty getting up and out of bed or getting in and out of the car. If they have stairs in their home, their bedroom may be upstairs and they can't walk upstairs anymore. So we'll work on different strengthening exercises, just different functional tasks at home to get them back to their level of function. Specifically with breast cancer, we see a lot of problems with that. There are a variety of surgical procedures now, and some of those procedures kind of reuse different muscles of the body to help reconstruct the chest wall, and that can change how the shoulder can function. People can have pain, limited range of motion. They may get lymphedema in their arm if they had lymph nodes removed. So we provide those services to kind of help restore function, help control pain, Tissue damage from radiation can be an issue. So trying to really just get people back to where they were before and reaching those goals.
When you were talking about your timeline of working with folks and dependent on whether it was an injury, a surgery, cancer, athletic training, different things, you spend a lot of time, it sounds like, with your patients. So I'm sure you get to know a lot of them pretty well. So how does that help with the progress that people make and the number of times you see them and the relationships that are built?
Right. Well, on the initial evaluation, it's good to get a thorough kind of background. So you know who their support system is. Are they living by themselves? Do they have family at home? So you're asking these questions initially to get to know them. And your treatment sessions are anywhere from 30 minutes to an hour, so you spend quite a bit of time with these people. So it gets boring talking about the same thing all the time. So you end up getting to know them, and it's nice because you can then know how to best encourage them, how to support them through their process. You can help identify services in the community that they may benefit from, that if you don't take the time to talk to them, that you wouldn't otherwise know. And it's also good to be able to kind of joke around and have a relaxed environment, because when you come to therapy, it's not all fun and games, but we like to make it fun and make sure that people at least kind of can say they enjoyed their time with us, even if it wasn't the most comfortable.
Distract them from the pain a little bit.
Right, absolutely.
So if someone's watching today, how do they get to the therapy services? Do they need to seek a doctor's referral first? Like, walk someone through this.
So Illinois is working on getting direct access for physical therapists, but right now it still requires a physician script. So you can contact your primary care physician, talk to them about the issues you're having, be it back pain, be it neck pain, knee pain, whatever it is that you're limited with. If you have someone that has trouble with balance and they're having falls in the home or something like that, or like we talked about with the pelvic health, all of those different issues, talk to your doctor, ask them if therapy is an option. There's a big push to try to get away from narcotic use and pain meds right now, with all the issues there. So therapy is becoming more of a popular option, which is great. So talk to your doctor about that. There's a website, carle.org/therapy. You can go there and get a little bit of information about our services as well. Our clinic here in town, the number is 238-5666. Sherry is usually there at the front desk to take your call and answer your questions. We accept most insurance policies here in the area. That's the only reason that you wouldn't be able to use our services, is if your insurance doesn't cover and you're not willing to pay out of pocket for that. But otherwise, there's no restriction on who's able to come and use the therapy services at Carle.
All right, that's all good information to know. So we just have a couple of minutes left. So let's talk about some get moving tips, and what do you offer to people who haven't been active, and what do you tell people, like, this is how you can help yourself?
30 minutes of exercise 3 to 4 times a day is kind of what we recommend. Walk. It doesn't have to be 30 minutes at a time either. You may take a 10-minute walk in the morning, a 10-minute walk at lunch, and a 10-minute walk in the evening if you need to break it up. But doing some kind of movement. For people that are sitting at a desk job all day, put a little reminder on your computer that tells you to get up. Every 30 minutes to an hour, stand up, just walk to the hallway and back, or something to move. You can get into a group fitness program. A lot of area programs here in town have exercise classes if you need a little bit of accountability or a little bit of encouragement. Exercise is fun when you do it together, so get into a group setting if you're not sure where to start. If you've been a patient at Carle when you graduate, as we say, and you're discharged, we have a program where you can come back and you can pay like a gym membership and you can use our facilities during the day as well. So that's a good option for people that are comfortable with having been in our facility. They know the exercises they've done, and we're standing by, not that we're giving one-on-one attention, but if there's any questions, we're there to ask. So that's always helpful as well.
And so diet, exercise, hydration, I'm assuming too?
Yes. Drink plenty of water. That's the best fluid. Have a little coffee too, because everybody needs some
Everybody
caffeine,
needs a little bit of energy there.
But yes, drink plenty of water, and yes, a healthy diet is very important as well.
All right, well, we've covered a lot of topics today. Sara Masse, the lead clinician with Carle Therapy Services. We've covered physical therapy, occupational, pelvic, urinary incontinence, cancer-related, athletic training, lots of services available, as well as a lot of great tips. So it's been a pleasure having you on the show today. Thank you so much for discussing all of this. So I'm pleased that you're watching. I hope you got a lot of information from Sara Masse with Carle Therapy Services today. Thank you for watching this episode of Being Well. And if you need more information, visit our website, WEIU.net, and click on Being Well. Thanks for watching.
Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Carle combines clinical care, health insurance, and research in a way that solves problems today with an eye toward the future. Supported by a deep philanthropic spirit and dedicated to making life better for as many as possible.